Hi, I'm Ashley Mellish, and this is my roommate Andrea, and I'm going to do my full head-to-toe assessment on her. So first off, I am going to provide privacy. I did hand hygiene as I came in the room. Can you tell me your name and date of birth, please?
Andrea Malarkey, 7/26/88.
Okay, and do you know what today's date is?
October 15, 2014.
And can you tell me why you're here?
I'm here for you to do a full assessment on me.
Okay, as she walked in, I was able to see that her gait is steady. She has active range of motion in all her extremities as she was walking without difficulty. She is alert and oriented ×4 to person, place, time, and situation. She appears clean and neat. There are no body odors that I can smell. There are no involuntary movements that I can see. She has on clothing appropriate to the season. It's a little cold outside right now, but she has a jacket that's over there. Her skin color, from what I can see now, is pink, and there are no lesions or masses visible. Let's see. I'm going to look at her nails, and right now she has on acrylic. So besides that, I see her on a daily basis, and I know that there's no clubbing or discoloration of her nails. Now I'm going to move on to her head. Let's see. As I talk to her, I see that she makes direct eye contact with me. As I said earlier, her level of consciousness is alert and oriented ×4. Let's see. Okay, first off, I'm going to start and inspect her scalp, and I'm just going to feel around. There's no lesions or masses that I can feel. Her hair is smooth and thick. There's no brittle texture. Let's see. I'm going to look at her face. Just head on. It's symmetrical. There's no dripping of eyelids or of mouth. Let's see. I'm going to assess her temporal artery. It's easily accessible. You can feel it bilaterally. Okay, and then I'm just going to feel by her T and J. Okay, can you open for me? Is there any pain or tenderness? Okay, and there are no clicks that you can hear. Okay, let's see. Next, I'm going to look at her eyes. You said you were contacts, correct? Okay, there's no visible drainage. Her irises are blue. Her pupils are black, and her sclera is white. There's no discoloration of her sclera. Let's see. I am going to do a light test on her now. What I'm going to do is I'm going to shine this light into both of your eyes. I just want you to look forward, okay? And I'm just assessing to see if your eyes constrict and dilate when they should. And her pupils are of normal size. I would say about 3 millimeters. So, and as I do this, I'm assessing to make sure that it constricts and dilates in this eye and then the eye opposite of it. So far, so good. Okay, and then I'm going to hold this pen light in front of you, and I want you to look at the pen light, and then I'm going to have you look at the top of the ceiling, okay? And we're going to do it 3 times. Look at the pen light, look at the ceiling, look at the pen light, look at the ceiling. When she looks at the pen light, her pupils both constrict, and then when she looks away at the ceiling, they both dilate. So that is good. Let's see, we're going to do the cranial nerve test. So I'm just going to hold this in front. I'm going to do it to the side. You just follow with both eyes, okay? Okay. And she was able to follow, her gaze was normal. She was able to follow the pen light without any difficulties. Let me do that again. Let's see. You do wear contacts. Let's see, no visual difficulties right now. So if we were to test her acuity, we would use a Snellen chart. We would hang that up on the wall and have her stand back 20 feet and cover each eye and read the numbers on it, starting with the top at the biggest number, and we would go down until she can read whatever the line is that she can read. That would be what her acuity is in each eye. Now I'm going to move on to her nose. It's symmetrical. There's no deformities. I'm going to look inside your nose. Okay. I don't see any nasal discharge, any bleeding, any sort of drainage, any blockages. Do you have any difficulty with breathing? Okay, we're going to assess your nasal patency. So I'm just going to put my finger on each nair and you're going to breathe for me, okay? Any difficulty breathing? Okay, so both nairs are patent. Let's see. I'm going to palpate your sinuses. Tell me if there's any tenderness. All right. Next, I'm going to move on to her mouth. Just looking at it, can you smile for me? She has a very nice smile. There's no asymmetricalness going on, which would be indicative of a stroke or any cognitive neuromuscular. Okay, now I'm just going to look inside her mouth. I'm going to inspect her buccal mucosa, her teeth, her gums, her tongue, the floor of her mouth, and her palates. So just go ahead and open for me. Okay, and let's see your tonsils. Okay, her mouth is pink, moist. She has straight white teeth. There's no indications of any kind of gingivitis. Do you floss regularly? Okay. I don't see any dental caries. There's no lesions in her mouth. She does have tonsils, I would say grade 1, but they don't look red or swollen. I don't see any tonsil stones or anything like that. Okay, swallow for me. As I can see, she doesn't have any difficulty swallowing, but again, I want to ask her, do you have any difficulty swallowing? Okay, so head, eyes, nose, mouth, neck. Okay, next I'm going to move on to her neck. First off, I'm just going to inspect. It's symmetrical. There's no lesions. There's no masses. I'm going to feel her trachea. There's no lesions or masses on there as well. Nothing abnormal. It's midline. Feel her thyroid. There's no enlargements that I can see. It's not. Is it tender? Or tender? Okay. And then I just want you to turn your head from side to side. I'm just going to test your muscle strength there. Okay, good. There's no, her muscle strength is good. There's no abnormalities there. Let's see, next I'm going to feel her lymph nodes. Tell me if there's any tenderness. No tenderness? Okay, so I've done the head, the eyes, the ears, the nose, the mouth, the neck. Let's see. I'm also going to feel her carotid pulse on each side. I would say they're strong bilaterally. Next, I'm going to move on to her chest. And for this video, she's going to keep her clothes on. Oh yeah, I forgot. I'm going to assess her ears. They're hidden, so it's easy to forget. Out of mind, out of sight. Out of sight, out of mind. There you go. Let's see. The bottom of her ears is in line with the bottom of her nose. If the ears were lower set, that would be an indication that there could be kidney issues. She does have her ears pierced. Besides that, they are both symmetrical. They both go in at the same. There's not one that sticks out further than the other. I'm just going to feel your ears. Tell me if there's any tenderness. No? Okay. I do not have an otoscope. I came here to get one, but they don't have one here. So I'm just going to use my pen light and pull her ear back. I don't see any drainage, any bleeding, any abnormalities there. Her canal looks normal. Her tympanic membrane, it's a pearly white color. There's no redness, there's no inflammation. Let me check on this side. Again, her tympanic membrane, it's a pearly white color. There's no redness, there's no inflammation. Next on your ears, I'm going to do the whisper test. So I'm just going to whisper on this side and whisper on that side. And you're going to repeat what I say, okay?
Chocolate.
Okay.
Candy.
All right. She was able to correctly repeat the words that I had said to her, so there's no difficulties in her hearing, and you don't wear hearing aids or anything of that sort. Okay, well then, I believe now I can move on to the chest. Just looking at her, I can see her breathe and see that there is symmetrical expansion. Do you have any past history of any respiratory issues, any cardiac issues? Okay, let's see. I don't see anything out of the ordinary, so I'm just going to just palpate the front and the back. Any tenderness? Any tenderness there? Okay. I'm just going to listen to her heart sounds, and then I'm going to listen to her lung sounds. So I'm going to start with her lung sounds. I'm going to start in the back.
Do you want my shirt off, girl?
And then I'm going to listen to her lung sounds interiorly. With her lung sounds, they were clear bilaterally. As I look at her, I see that her depth of breathing is regular. There's it's unlabored breathing. There's no difficulty of breathing, just as a whole. Let's see. Next, I'm going to listen to her heart valves. There's the aortic, the pulmonary, the tricuspid, and the mitral. The aortic is at the second intercostal space, or right sternal border. The pulmonic is at the second intercostal space, left sternal border. The tricuspid is at the fourth intercostal space at the, I can't think of the word. Maybe I'll spell it. Right here in the middle. And the mitral is at the fifth intercostal space at the mid-clavicular line. So I'm just going to listen to her heart sounds. And then I would want to listen to her apical pulse for 1 minute. For this video, I'm not going to listen to her apical pulse for a whole minute, but from what I can hear now, it sounds regular. Also, as I'm looking at her, I forgot to mention that just assessing her shoulders, there's not one that's higher than the other, so they're symmetrical there. Let's see. I'm going to assess your range of motion again. I saw it when you came in, but I want to assess it for this video. So can you just lift your arms for me? Okay, side to side. All right, you can put them down. So she has full range of motion in her upper extremities. And then I'm going to have you grip my hands. Grip them. Her grip is strong, bilaterally. Let's see. I think I'm going to move on to her abdomen. You want to lay back for me. You can lift your shirt a little bit. Okay, just looking at her abdomen, I can see that it is a symmetrical contour. It is flat. There are no skin issues. She looks tan. She's probably been in the tanning bed, which is bad for her. But there are no skin issues there. Her umbilicus is midline. She hasn't any. Let's see. Next I'm going to, before I palpate, I'm going to auscultate her bowel sounds. My hands are cold, just so you know. Her bowel sounds are normal active in all 4 quadrants. I'm going to palpate her abdomen for any tenderness. So let me know if there's any tender spots. My hands are cold. Everybody always tells me they're cold. Are you tender? Oh, anywhere? Okay. Next I'm going to assess her, or I'm going to assess her organs. I'm just going to palpate where the liver is and where the spleen is. The liver is in the right upper quadrant. It would be right here underneath the end of the rib cage. Sorry.
It tickles. Sorry.
The spleen is in the upper left quadrant underneath this rib cage. So to do a liver test, basically, I would put my hand where the liver should be, or where the liver is, and then I would scratch right here. But if I scratch on her, she's going to laugh. So I'm not going to do it on her. But if there was any liver enlargement, then that would be tender as I did that. And same thing for the spleen. If there was any liver or spleen enlargement, then it would be tender when I felt over there. So, all right, next I'm going to just look at her lower extremities. Can you just roll your hands up just a little bit for me? Okay. Okay, as I can see, well, she did shave her legs for me today, so that's good. But her legs seem to be symmetrical. Are there any issues on your thighs or whatnot that I can't see?
No.
Okay, let's see. Her legs are symmetrical. Her skin is pink. There aren't any lesions or any sort of masses or anything abnormal with her legs. She is warm. My hands are cold. Let's see. I do not see any varicose veins on her. Next I'm going to palpate her pulses. The popliteal pulse is right here behind the kneecap, so I would want to palpate those, listen to them. It's hard to listen or to feel them through her pants, but when I did this at home on the assessment, they were strong bilaterally. And then this is a dorsal pedius, and this is just at the top of her foot. Here, put your feet up on me. So you would just feel those, and they're strong bilaterally. And then the on the inside of her foot. This is the posterior tibialis. And those two are strong bilaterally. Okay. Okay, what I'm going to do is I'm going to have you stand up for me. I'm just going to test and make sure that you're able to bend, that there's no deficits in your range of motion. And one. Okay, so stand up for me, bend your knees. Okay, can you lift this foot up? Okay, can you lift this foot up? Okay, you can sit down. There is one thing that I forgot to, when I was assessing her pulses, I forgot to look at her brachial pulse. So, okay, they're strong bilaterally. I feel like I have a little bit of speech impediment. As she was able to stand up and move for me, I was able to see that there are no joint issues. Do you have any joint issues or stiffness? But I didn't see any. That her knees, they bend fine. I'm going to have you stand up for me one more time. I'm just going to have you turn this way. And then I'm just going to have you bend over a little bit. Okay, you can stand back up. All right, you can sit down. When I had her bend over, I was just looking at her spine to see if there was any evidence of scoliosis. And there's no curvature in her spine, any abnormal curvature. I believe if there was scoliosis, that would be a curvature of greater than 10% or 10 degrees. And I did not see that with her. Let's see. We are going to do, let's see, a test. It's called the Romberg test. Basically, I want you to close your eyes. Okay, and I want you to hold your hands out for me. Okay, keep your hands there for a few seconds. Okay, you can drop them. If there is any neurological or musculoskeletal issue, any issues with her, then her hands would have drifted, but they didn't, so she is good. Let me see what there was another thing that I needed to test it with her feet. I don't remember the name of it, but it's basically where she takes the back of this heel and she rubs it along the top of this foot. So I'm going to have you do that on both feet for me. Okay, and then on the other one. And then I'm going to have you do the finger to nose test. So I just want you to hold your finger out, just like this, and then touch your nose. Okay, and then do it with the other one. Okay, and touch your nose. And if the heel to the top of the foot or the finger to nose test would have failed, that would be a sign of something neurologically wrong with her, but she does not have that, so that's good. Let's see, next I'm going to have you close your eyes. What I'm going to do is I'm going to touch a part of your body. I need you to tell me where I'm touching, okay? And if it's the left or the right, I need you to tell me that as well.
Left shoulder.
Okay.
Right arm. Forearm. Left knee.
Okay. Next I'm going to test reflexes. I'm going to test the brachioradialis, which is just going to be midline on her forearm. So do that. When you do this test, the elbow should jump a little bit. So it's hard to see with this one. Okay, we'll do that. And then I'm going to do her patellar reflex. And this is just right below the kneecap. And you might not be able to see, but there's a slight jerk whenever I hit that. And then her Achilles tendon. I think it hurts. I'm trying to think if there's anything I missed. I'm sure there is. Is there anything about your health history or Anything physical that you have any questions about?
Nope.
I'm sure there's a few things I missed. I can't think of them right now though. But that is my complete head to toe assessment on Andrea. So thank you.